Hey guys, Dr. Segel, UroCoach. There are tons of people in the United States and the world that catheterize themselves. Today I'm going to tell you some tips to keep your bladder healthy if you catheterize yourself. Stay tuned. Hey guys, Dr. Segel, UroCoach. So the question is, I catheterize myself. How can I keep my bladder as healthy as possible? But please first like, subscribe, comment. We want to hear what you guys want us to talk about. And at the end, I'm going to give you my pearl of wisdom for something that people don't always think about that can keep your lower urinary tract healthy if you catheterize. So let's get right into it. So one of the things that is super important and it's obvious is that you want to catheterize on the schedule that's told to you by your urologist or healthcare provider, okay? Remember, doing this keeps the bladder empty on a regular basis. Now, why is that important? I'm going to tell you 3 reasons why that's important. When you catheterize yourself, there's always a little bit of bacteria entering the lower urinary tract. Even if you have a perfect technique, that's just the reality of going past the urinary sphincter, okay? We don't want that bacteria to stay in your bladder because it causes, urinary tract infections, which can be symptomatic. So if you can keep your bladder empty on a regular basis, it decreases the chance that you're going to have a symptomatic urinary tract infection from catheterizing, all right? So you want to catheterize on the schedule that your urologist tells you to keep your lower urinary tract as empty as possible to decrease the chance of you getting a urinary tract infection, number 1. Number 2, remember, the bladder is a hollow structure, okay? It can stretch, it can shrink. You want to keep the bladder as empty as possible by catheterizing on the right schedule, because if it overstretches, as urologists we call it over-distension, if it stretches too much, then you can lose bladder function. So some people that catheterize, their bladder does not function at all. That's just the reality of it. But some people have some bladder function. And if you catheterize too infrequently, the bladder will stay stretched over time. And that stretching of the bladder will decrease the muscle function of the bladder and make the bladder muscle actually die over time. Remember, your bladder is a muscle like other muscles in the body, bicep, quadriceps, etc. And your bladder is as muscular as it can be when it's emptied on a regular basis. The final reason why it's super important to catheterize on the schedule told to you by your healthcare provider is because you want to protect your kidneys, all right? Your bladder sits below your kidneys. Look at this schematic and I'll explain to you why it's super important to catheterize on a regular schedule to protect your kidneys. Watch this. Okay guys, if you look at this schematic here, so urine is in the bladder, it's about halfway full. What we don't want is we don't want it to be super full. Pretend this red is additional urine accumulating in the bladder, right? Because what'll happen is that urine can then back up and then go up this tube called the ureter, and the next place it goes after the ureter is the kidney. And if you're not emptying your bladder on a regular basis, urine traveling to the kidney from a bladder that is over-distended can cause kidney damage over time. Okay, next tip I'm going to give you is hydration. Now, I know that's super obvious and people tell you that all the time. I'm going to tell you 2 studies that sort of illustrate my point, okay? One of them was told to me by one of my professors when I was training. There was this really unethical, frankly, study that they did many years ago before this would be allowed, where they took 50 medical students and they put bacteria in their bladder. It's called inoculating them. And they took 50 other medical students and they put bacteria in their bladder. One of the groups, all they did was hydrate. They just drank copious amounts of fluid. And the other group got antibiotics, but they limited their hydration. And can you guess which group cleared the urinary tract infection quicker? Yeah, it was the group that actually just hydrated and did not get antibiotics. And that sort of proves my point that hydration is super important when you're getting bacteria into the urinary tract on a regular basis. You want it to get flushed out. So make sure you stay well hydrated. And the second study I want to tell you about is from the Journal of the American Medical Association. So they took 140 women that had what's called recurrent cystitis. And for intensive purposes, that means recurrent urinary tract infections, okay? And these were individuals that drank less than 1.5 liters of fluid per day. They took them and put them into two groups. One group, they said, keep drinking the amount that you've been drinking, less than 1.5 liters per day. The other group, they said, drink an additional 1.5 liters per day. And guess what? The group that doubled their hydration or drank an extra 1.5 liters of fluid per day had a 50% reduction in the incidence or the chance of getting what's called recurrent cystitis or urinary tract infections. Make sure you stay well hydrated if you catheterize yourself. Okay guys, and this brings me to my pearl of wisdom. You want to choose a catheter that works for you, okay? So you want to work with a company that provides a lot of different options. For instance, does it need to be hydrophilic? Hydrophilic means water loving, right? So the lining of your urethra obviously has water on it, in this case urine, but water in it. And so if the catheter has water on it too, then sometimes that catheter will go in more easily. And we want the catheterization process to be as easy as possible, so you'll catheterize on the right schedule, which we talked about. And we want to decrease the chance of any micro trauma to the urethra, right? Catheterizing can cause irritation of the lining of the urethra, the bladder, etc. And if it goes in more easily, that micro trauma is less likely to happen, and any bacteria that may get seeded along that tract is less likely to travel into small blood vessels, which is optimal. Other factors when you work with a company is, do they have Coude tip? And we have another video on that, which is a special kind of catheter that can usually travel past prostates more easily. Does it need to be a certain length? Does it need to be a certain caliber, right? So if you have urine that has sediment in it, you want to make sure it's drained adequately. So it might need to be a slightly bigger catheter. Is discretion really important to you? So we want you to catheterize on the schedule that they told you to catheterize on. If it's important for you to be able to hide the catheter and put it in a place where people can't see, catheterize discreetly, then we want you to have that kind of catheter. Also, people ask us oftentimes if we have a catheter company that we like. We really like 180 Medical because they're very responsive, their representatives are extremely knowledgeable, and they have a huge breadth of different types of catheters that you can choose to see what's perfect for you. Anyway guys, I hope that's helpful to you in giving you some tips on how to keep your bladder and lower urinary tract healthy when you catheterize. You guys are doing a great job by catheterizing. I know it's not an easy thing to do. Please like, subscribe, comment. We certainly appreciate your time. Best of luck to you.